Hey YouTube, I'm back with my second video. This video is basically gonna be over um basically my doctor and my quote. So sorry y'all, I was eating. As you all know, my doctor is Dr. Tanya Medina. I'm not gonna get into much detail about her. I was gonna like read her bio and all that, but I'm sure y'all have heard that already and I don't want to repeat it. And besides that, there's a lot of stuff to read and I don't feel like reading all this stuff. But I will tell y'all why I chose her. So I chose Dr. Medina because I love her work. Her work is amazing. All the dogs that I seen that went to her, they look spectacular. I love the fact that she was very professional and that she contacted me back like almost immediately after I contacted her. I also like that she speaks English plus, because that was my main thing, finding someone that spoke English. Not only that, the fact that she was a woman. I knew I did not want a male doctor. I wanted a woman. It was just my preference. So that was another reason I picked her. I also like the fact that she's kind of strict on what she will and will not do. I love that because I feel like she really cares. She cares. She's not gonna do all these procedures just because you said, or just because you say that's what you want to get your money. She's gonna tell you up front what she feel like is what is better for you at the time. Because y'all, I initially wanted a full mama makeover. I wanted my boobs done, I wanted butt, everything. I wanted everything. And she told me, she was like, even though my hemoglobin was really good, she still told me that she didn't feel like having all those procedures at once would be good on my body. But she would definitely, that I would need a round two, and she would be more than happy to be my surgeon for my round two. I'm not 100% sure if I'm gonna come back to do my boobs. I may just do my boobs in the US and I may just leave my boobs alone. I'm not, I don't really know. It just depends on how I'm feeling about my body. Because baby, if my stomach is flat and that ass fat, I probably ain't gonna need to get my boobs done. For real. But yeah, so I love that about her. She was open and honest. I love the fact that she only has one driver that actually picks up her patients. I like that. I also like the fact, like, a lot of people, when I first started doing YouTube, when I first started researching, I thought DR only had one clinic, which was Cipla. But like when I was watching the videos, I kept seeing CICILIP, and I was like, it don't look like it's pronounced Cipla. But even still, I was like, well, I guess that's how they pronounce Cipla. I don't know. But come to find out, it's not Cipla. It's a totally different clinic. So I was happy about that because y'all doing y'all research and y'all heard, I'm sure y'all heard about Cipla. So that was a plus with her. And she's just an amazing woman, you guys. She's just amazing. Like, I've already fallen in love with her. She haven't even did my surgery yet, you guys, and I'm already in love. Like, I thought once I reached out to her and I got my quote and I sent off my deposit and everything like that, I didn't think I was gonna hear back from her anymore after that until like maybe and then I felt like I was gonna have to reach out to her like a week before to let her know, like, hey, I'll be out there. Remember, my surgery date is this day, y'all. Not even. She WhatsApps me like at least once a week, and she sends like little inspirational quotes or whatever. She asks how you're doing, how you're feeling, and she lets you know, well, I'm excited, for your date. I'm excited to give you the best version of you. And she, like I said, she's just been awesome through this whole process. Like, I'm not worried, y'all. I am at ease because I know I am in good hands. Like, I'm not scared, I'm not stressed, I'm not nervous about the surgery. I'm nervous to be going to the DR alone, but as far as having a surgery and stuff like that, things going wrong, I don't feel no type of way about that. I'm not nervous about that. I know I'm in good hands. So yeah, I ultimately love my doctor. I love Dr. Medina. I'm so glad I chose her as my surgeon. Like I said, she haven't even touched me yet, y'all, and I already like I just feel like she's amazing. I feel like she's awesome. Her spirit, her spirit is awesome. Just seeing her on the videos and on YouTube and stuff like that with the other dolls, like she's just, I just love, I don't know, I just know she was my doctor, y'all. I just know that she is my doctor and I am in good hands and I'm not worried. I don't feel no type of way. And y'all, she did beauty pageants. I thought that was so amazing because she is such a pretty woman to me. So for her to do beauty pageants, that was a plus too. But yeah, those are really all the reasons I chose her. I she just amazing woman. I love her work and I love the fact that she is professional. I love the fact that she you can tell she loves what she does. You can tell she loves what she does and she cares. That's another thing. That's a big thing. I actually feel like she cares about me. Cause I had reached out to her after the fact, y'all. I have keloid skin. If y'all don't know what that is, if y'all ever seen people like with them big old things on their ears, or like a big long scar looking thing, look like tissue buildup or something like that, or like I say, had them big things on their ears. Like my skin do that. I used to have them on my ears and I got them removed. And after I had my first child, after I had my C-section, I keloided or whatever, and I had to have that one removed. So I reached out to her and I asked her, was she familiar with keloid skin, and she was definitely familiar with it, and she definitely put me at ease because she let me know that she would be able to give me the steroid shots without an extra charge. So I was like, yeah, because I didn't want to go out there. My concern was I'm gonna have this banging ass body, but then I have all these ugly scars everywhere where they can indicate, oh yeah, she had work done. I'm not worried about people knowing I had work done. It's just the point. Them scars are not cute, y'all, and they get bigger and bigger over time. That is not sexy. It would defeat the purpose of me going to get the surgery. So she definitely put me at ease with that because she already knew. She knew what she was talking about when she told me she would be able to give me the steroid shots. I was like, cool. She know exactly where I'm coming from with it. So yeah, that, y'all, I love the lady, y'all. I love her to death. She is an awesome lady. But enough of that. Let me get into the price rundown for you guys. As you guys know, well, y'all might not know, but as y'all know, I've been doing research for about 2 years. So I'm gonna do 2 quotes because I reached out her before, like last year, April last year. I reached out to her and I got a quote, and then I reached out to her February this year and got a different quote. It's a bit of a price difference, and I'm just gonna let y'all know what the price difference is. Okay, so with the quote, and I'm just gonna read my quote. So this is the quote. This is my quote for the surgery, the one that I did in February. Okay, so here she goes. Hello, doll. I think I can do a very good job to improve your figure so you can be the best version of you. After seeing your pictures, I understand I can improve your body with the following interventions: tummy tuck with muscle repair, liposuction on waist, liposuction on lower back and upper back, liposuction on flanks, with or without lipo injection to the buttocks, BBL. The price will be the same. And then it go down and it has the price, US dollars 4,800. Recovery house included. Now this is the 4,800 is not including the recovery house. It says 4,800, and under it says recovery house included, shared room, all the meals, nurse 24/7, AC, Wi-Fi. US dollars 85 per night, 10 nights, $850 for 10 nights. Transportation, airport pickup, medical checkup, bring you back to the airport, US $100. So the total with all that, with the recovery house for 10 nights and the transportation, it'll be $57.50. Now, everything I'm gonna say after this is basically the same from the first quote, except the price was a little bit different. The first price rundown was Lyric Move. Sorry y'all, I gotta get in this video. Okay, so the first price rundown, and I reached out to her April 22nd of 2017. Y'all, I'm itching right here. I'm not digging in my nose. So the first price rundown was $4,500 US dollars, and then with the recovery house and the transportation, it would have been $53.50. So it's like maybe a $350 difference. Not that big of a difference, which I wasn't tripping, you know, or whatever. So let me get back to what it says. So yeah, that was the first quote I got, and then the second quote, like I said, is about a $350 difference. Okay, then it proceeds to say extra areas of liposuction are $300 US each. You have to have a primary liposuction area. Important note: if you have to receive a blood transfusion after surgery, it's $200 US each bag. Most patients need 2 bags. $200 extra day stay in the clinic. So if you have to get it starts getting a little pricey, y'all. If you have to get a blood transfusion, which I'm look, I'm speaking it into existence. I'm not gonna need no blood transfusion, but it'll be $200. So it'll be $400 for the blood transfusions, because most likely you're gonna need 2. And then you're gonna have to pay additional $200 to stay in the clinic. So that's $600 right there just for a blood transfusion. So ladies, it is very important that y'all bring extra money. Don't just go down there with like the price she quoted you and maybe like $5 extra $100. You're gonna need to bring like maybe $15 extra $100 just to be on the safe side. And then it say extra areas will depend on your hemoglobin levels. Arm US $300 for both arms together. Inner thighs, posterior thighs, interior thighs, lateral thighs, armpits, chin US $300, bikini US $300. To make a recovery house reservation with us, you have to access myhomerecovery.com. Companions, and that too, y'all. I like the My Home Recovery House. Like everything that she's connected with is amazing. Like even no bad reviews with My Home Recovery. To make a reservation. To make a recovery house reservation with us, you have to access myhomerecovery.com. Companions at the recovery will depend on recovery house availability. US $65 per night. Private room will depend on availability. US $100 per night. Excuse me, y'all, because somebody is then got in my video. Fred, come get your sister in my room. Sorry, y'all. I'm not editing that either because I don't know how. So she's just going to have her little face up in my video, and I'm not starting all the way over. Get her and get out. And don't laugh at my baby. Her scalp real sensitive. She be bleeding, so I had to put a lot of little spiders in her head. Okay, back to this. So US $65 per night. Now, y'all, if y'all was listening, y'all heard me say earlier in the quote that the recovery house was $85 a night, but right here it says $65 a night. So I'm gonna have to find out because I don't know, but I do know you have to the deposit. Private room depend on availability. US $100 per night. You have to make $100 deposit before you get out there. If you was okay, and then it says if you will stay at other recovery house, you will still need to be picked up by my chauffeur. He knows all the process with blood work and x-rays, and he's the only one allowed to pick up my patients. I love that. I love that she have her own personal chauffeur. If you have family here to pick you up at the airport, let me know, and we will set a time to meet each other 2 days before surgery at the clinic. Kids are not allowed at the recovery. But of course, Our clinic does not accept several deposits to pay our surgery in advance. They only accept one deposit to save your date, US $500, that will be deducted from your total balance of your surgery. Our clinic only accept credit cards with a 3 to 5% extra charge or a US cash. And if you will pay with debit card, you have to arrive 5 days in advance, y'all. 5 days in advance if you paying with debit. So if I was y'all, I just take my money off my card and pay cash, because you have to arrive 5 days earlier, because they only allow you to take off $1.99 swipe per day. Then extra expensive, more money you're gonna have to spend, y'all. $150 health insurance, which is mandatory. $140 for your second stage garment. I will be getting my second garment out there. I will not be getting one out here. I'm not gonna get one offline. It's just more convenient for me to just get everything out there. I didn't try to get no medicines from out here, none of that. I'm just gonna pay them and get my medicines. The pain medication I got, I know people be saying that they medication not as strong as the US medication, but I strongly feel like I'll be alright. I talk to my PCP. If I come out here with any complications, or if I need anything stronger, then she'll be able to subscribe me something stronger. But US $200 extra day at the clinic, $100 lung evaluation, which is mandatory. And then it goes on, it tells you the airport you need to come in. Of course, you need to arrive 2 days before. She recommended that we stay 15 to 18 days, but the minimum is 10 days. If the patient cannot stay minimum days requested, he or she will assume the risk of blood clots, seromas, and liquid accumulations, leaving with the drainage in case of tummy tuck wound and other infections and several pain. So she do let you know if you leave early or if you're not able to stay long that you do have complications. And then it goes, we only fill FMLA patients when we receive patients' deposit. It is a clinic's policy. So if you don't pay your deposit, they not doing your FMLA. Good thing stuff was going terrible at my job to where I had to relieve them, so I don't have to do the FMLA. Then it goes into the time of the patient surgery. It depends on how many procedures she got. Blase. You know, you can't pick, oh, I want to go first. She has to, you know, she picks that or whatever. So all that. And then it goes, the end, it says, it is very important that you check prior to planning your surgery the following: your hemoglobin levels and your BMI. Your BMI limit is at 35. Y'all, I didn't realize this thing was this long. Okay, so your quote includes a private nurse if you come by yourself. If you come with a companion, the quote wouldn't be less. Patient coordinator to be attending all your needs in the surgery process. Honorary medical staff, surgeons, helpers, nurses, medical care, post-surgical anesthesiology, surgery room, surgical equipment, waste materials room, no specialized and specialized surgery, anesthesiology, disposable drugs and recovery room. Room 24-hour extra day or $200 US. Monitoring and curious post-operatively. One post-surgery garment. Labs, and it just go into all the labs they gonna do. Cardiovascular evaluation, EKG, your x-rays, all that. Important note, the administrative process and balance of fees is due 48 hours before surgery. Prices in American dollars. To book a surgery date, you have to make a US $500 non-refundable deposit. Prices guaranteed only for 3 months. Any other test is not listed, is extra. If you do have diabetes, asthma, cardiovascular, pressure problems, smoke or smoked, or has any other disease, bring an extra $300 for for a specialist evaluation to approve for surgery. The procedures will depend on your hemoglobin levels. It is important to have a good hemoglobin level to have your surgery done. Your hemoglobin level to have your hemoglobin levels has to be over 12 for one procedure, more than 13 for 2 procedures, and more than 15 for 3 procedures. It is recommended to stay 14 days after surgery or depend on the procedures. Take iron pills 6 weeks before surgery, 2 weeks before. Stop all that contain vitamin A and E. You must remain off work for 3 to 4 weeks. If you do not have a place to stay, you can use a recovery house. Okay, y'all. I'm not finna. Oh, okay. So yes, I am about to read this. So remember, I was saying earlier that at the top it's like it said 85 and then 65. Okay, so now if you don't have a place to stay, you can use a recovery house. The cost is $85 a night, all inclusive. Also, we can coordinate transportation. Non-surgical guests stay at the recovery house for 65 days plus transportation. Okay, so it's 85 for the patient, and if you bring in a companion, it's 65. Okay, so they clarified it. And then it goes into the medications you're gonna have to take, which is approximately $250 more. Your lymphatic drainage massage should be performed. Recommended are 10 massages. This costs about $300. The insurance is mandatory. If you smoke, you have to get 6 hours. Each hour costs $100 of oxygen treatment. Y'all, it adds up. It adds up. So please, 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 y'all, bring extra money. I will be bringing $1,500. I'll be bringing $1,500 extra dollars. Anything over that, but I'm gonna bring my own snacks, and that'll be in my packing video. I'm bringing my own snacks because I'm a snacker. I love to snack. So I will be bringing my own snacks. I don't plan on doing no exploring out there, and I only plan on staying 7 days because I am a mother and I have to get back home to my children. It was already hard finding me somewhere. Well, it's already gonna be a strain on my significant other to be holding down the fort, going to work, and keeping the kids. That's why I kind of wanted to schedule my surgery around the end of the school so my oldest son can kind of help out a lot. But yeah, this video ended up being so long, y'all, and it's still more to go. But this stuff is basically like the medications. She put the medications you gonna need. I'm not finna even try to pronounce these little medical term word things. Just know you're gonna need an additional $250 for the medication you're gonna need if you cannot get your medications out here. I know a lot of people like some of these you can actually, like the vitamins, like the vitamin C and the iron tablets, and I know some of these are over-the-counter medicines, and then this little cream, y'all can get that out here. But like I said, I'm not even finna waste my time trying to do all that. I'm just gonna get the medicines out there. And if you break your drain, it's additional $25. So yeah, that's basically it. She left her you know, her phone number, her WhatsApp number, and her website down there. So yeah, you guys, I made this a long video. I wasn't planning on it, but hey, there was a lot of stuff I had to read. Oh, and I read that off my phone through my Gmail, but I will be printing mine before I get out there, having it in hand, because I don't remember who I watched, but she was like, it'll be a good idea to have the paperwork in hand, you know what I'm saying? So I will be printing mine. But that's gonna be the end of this video, guys. Thank you so much. Don't forget to like, comment, and subscribe. Y'all leave comments if y'all have questions that I can answer. I would be glad to answer them. So subscribe, like, and comment, and I'll see y'all in the next video. Bye.